How many of you do suffer from acidity or gastroesophageal reflux disease? And how many of you would truly like to get rid of these acidity symptoms that keep haunting you day in and day out by just doing a few changes in your diet and a few changes in your daily routine? This is Dr. Lenny DeCosta, a geriatric physician and a functional medicine expert, and the author of the upcoming book, Is Your Doctor Keeping You Sick? My dear friends, yes, in the last 17 years of my practice, where I've treated over 25,000 heart patients non-surgically, a number of my patients have kept coming to me and telling me we're suffering from this acidity problem and we need a solution for it. It's hampering our day-to-day lives. It's causing so much of discomfort, and at times the chest pain seems like a heart attack, but it's nothing but this GERD or gastroesophageal reflux disease. My dear friends, today I want to share with you a few tips that you can use in your day-to-day lives, the changes in your diet, the few habits that you can modify and live a healthy, happy life. To start with, the 2 changes you need to do in your diet. 1, give up all wheat products. And number 2, stop milk and milk products. So diet, 2 changes, wheat and milk have to be avoided. Then you need to eat half your portions that you normally eat. What do I mean by this? Generally, we are used to eating 3 solid meals, a good breakfast, a good lunch, or a good dinner. And that is our cardinal problem. We eat so much during those 3 times that we overfill our stomachs. So people who actually suffer from the symptoms of acidity are required to actually have smaller portions and probably eat a little more number of times if you feel hungry, and more healthy food rather than 3 big meals. So if your dinner, or you have acidity post-dinner or post-lunch, reduce your quantity of food to half and change the kind of foods that you eat in that food. So you cut down your carbohydrates, have a lot of fiber, a lot of veggies in there, and reduce the spice. So the 2 things in your regular food: cut food size or cut the meal size, and have a bland meal, no spices, absolutely. Yes? Then the 5th, so I've given you 4 already. The 5th one is you need to eat very slowly and chew the food absolutely slowly so that you enjoy eating the food, so you taste the food properly. Most of us are so worried about getting back to work or eating fast and getting around to doing what we need to do that we don't chew our food properly. Most of the reasons why we have hypoacidity or hyperacidity is because the food is not chewed properly. Please understand that when you eat, your digestion starts with the chewing process, and if you do not chew it in your mouth properly, if the saliva doesn't mix with it properly, the entire digestive problem starts there itself, and that is when your hypoacidity or hyperacidity or whatever you want to call it does take place, and you start getting the symptoms of gastroesophageal reflux disease or acidity as you normally term it. And finally, my dear friends, the last but one of the most important of all the changes you need to make in your routine is you do not go and lie down in your bed or go to sleep immediately after a meal. That is one mistake most of us make. We have a nice heavy meal and we go and lie down on our beds and go to sleep. This does cause a reflux. You need to be sitting around or just roaming around in your house or having a small walk outside in the balcony if you can, which actually lets the food go a little lower into the gut, starts the digestive processes, and by the time you go to sleep, it's well beyond your gastroesophageal sphincter, which is responsible for GERD or acidity that you say you have. So my dear friends, I'd like to repeat my 6 points. Stop wheat, stop milk, eat slowly, eat less spicy food, smaller portions of food, and do not go to sleep immediately after a heavy meal. Having said this, one other thing that you need to take into account, which I normally tell most people, is always stop fried foods. Avoid too much of fried foods or deep fried foods, because these always create an irritation in your gut, because they have a lot of trans fatty acids and they always have spice in them, and they do cause an irritation in your gut. If you like this video, please share it with your friends and relatives. Use the 6-7 tips that I've given you, and these are the ones that I've given most of my patients who have responded back to me and always said that they have felt better, that the symptoms of acidity have gone down, and they can live their normal lives. If you like this video, my dear friends, please share it. Please give me that thumbs up. Please visit my YouTube channel. I've got tons of videos for your good health there. And if you need my advice, or if what I do resonates with you, or if you're interested in helping some of your relatives, please get in touch with me on the number, WhatsApp number below here, just here, or send me an email on the mail ID I have just mentioned here. I'll see you soon in my next video. Bye.